This is Case of the Week 11. My name is Dr. Johnson and I'm a gynaecologist from Southampton. The patient was 28 years old and complained of pelvic pain, mainly related to her periods. At that time, she would have dyschezia, pain on opening her bowels, and also dyspareunia, pain on intercourse. She also had been trying for a baby for the last 3 years. This is a transvaginal ultrasound image of her pelvis. The probe is in the posterior fornix, so the cervix is here. The rest of the uterus is off the screen. This is the patient's head end, and this is her foot end. So this is an image of the pouch of Douglas. And this is a 3D image of the same place. This is a video of the probe being inserted through the vagina into the posterior fornix and showing the pouch of Douglas. There's bladder, vagina, cervix, posterior vaginal wall, and into the posterior fornix. What's the diagnosis? Is it a bowel cancer, cervical cancer, pedunculated fibroid, a nodule of deep infiltrating endometriosis, or an ovarian fibroma? This again is the image of the 2D scan. Cervix, uterus is off screen there because we're in the posterior fornix. This is the pouch of Douglas. And here you can see an irregular solid lesion in the anterior bowel wall. There's a bit of normal bowel wall, and there's another bit of normal bowel wall. And this is the same lesion seen on 3D. This is the bowel, this is the anterior bowel wall, and here is this lesion, a solid irregular lesion. Looking again at the TV insertion of the probe, posterior vaginal wall, posterior fornix, pouch of Douglas, and this irregular solid lesion in the bowel wall. You can see that there is no sliding sign on moving the probe in the vagina. The pouch of Douglas and the cervix are adherent to each other. There's no sliding there. This is what a normal sliding sign should look like. On gently removing and inserting the TV probe a little, you can see that there's a lovely sliding movement here between anterior bowel and posterior cervix. This is a normal sliding sign. This was a nodule of deep infiltrating endometriosis. The key features of nodules are: you should examine the patients with pelvic pain very gently. Slowly insert the TV probe and watch the posterior vaginal wall for any nodules. Then place the probe in the posterior fornix behind the cervix and look for more hypoechoic lesions, nodules, in the pouch of Douglas, mainly behind the cervix and at the cervical internal os. This is called the torus uterinus, where the uterosacral ligaments attach. Having done that, place the probe in the anterior fornix and gently press the cervix a few times to elicit the sliding sign. The sliding sign is normal movement between the posterior cervix and anterior bowel wall, and a reduced movement here implies adhesions in the pouch of Douglas. You should look for this in all your patients, as it's quite a good screening test for endometriosis. Thank you.